Hello, everyone. I'm Gina with Inspire Medical Systems here in San Diego. I just want to introduce to you Dr. Marcia Ruther. She is our ENT with San Diego ENT in La Jolla. And joining Dr. Ruther today is our patient, Karen Walk. So you will have an opportunity today to hear from Dr. Ruther regarding the Inspire system and from our patient, Karen, that has had her device now for a couple years. She will also share her experience. So thanks again for joining us. We are going to go ahead and get started, and I'm just going to hand it off to Dr. Ruther to do an overview of obstructive sleep apnea. Dr. Ruther?
Perfect. Thank you. So, obstructive sleep apnea is a very common condition that occurs when the muscles in the back of your throat relax too much during sleep to allow for normal breathing. When the tongue and soft palate relax, your airway narrows or closes as you breathe in, and breathing may be inadequate for 10 seconds or longer. This may lower the level of oxygen in your blood and cause a buildup of carbon dioxide. Your brain senses this impaired breathing and briefly arouses you from sleep so that you can then reopen your airway. This awakening is usually so brief that you don't remember it, but some people do wake up with a snorting, choking, or gasping sound. This pattern can repeat itself 5 to 30 or more times each hour all night long. And these disruptions impair your ability to reach the restful phases of sleep. Some people may not be even aware that their sleep is being interrupted. And a lot of people feel like they slept well all night, but they feel tired in the morning. So that brings us to the signs and symptoms of obstructive sleep apnea, which can include excessive daytime sleepiness, loud snoring, observed episodes of stopping breathing during sleep, abrupt awakenings accompanied by gasping or choking, awakening with a dry or mouth or sore throat, morning headaches, difficulty concentrating, depression or irritability, high blood pressure, nighttime sweating, and decreased libido. If you don't mind going back to that first slide, Gina. So, sleep apnea is diagnosed with a sleep study, and you can see a small snippet of the sleep study on this slide in the bottom corner. This sleep study demonstrates two apnea episodes. In the first one, the person stops breathing for 47 seconds and their oxygen level drops to 84%. In the second apnea episode, the person stops breathing for 86 seconds and their oxygen drops to 74%. Normal oxygen level is about 92%. And imagine holding your breath for 86 seconds. We can go to the next slide now. Obstructive sleep apnea is considered a serious medical condition, therefore, treating it is extremely important. Consequences of untreated sleep apnea can include daytime fatigue and sleepiness with diminished productivity. The repeat awakenings, again, don't allow for normal restorative sleep. Therefore, people with sleep apnea often experience severe daytime drowsiness, fatigue, and irritability. They may have difficulty concentrating and find themselves falling asleep at work, while watching TV, or even while driving. They may also be at a higher risk of work related accidents. Children and young people with obstructive sleep apnea may do poorly in school and commonly have attention or behavior problems. Cardiovascular issues can result from untreated sleep apnea. The sudden drops in blood oxygen levels that occur during obstructive sleep apnea increase blood pressure and strain on the cardiovascular system. Many people with obstructive sleep apnea develop high blood pressure, which it can increase the risk of heart disease. And the more severe the obstructive sleep apnea, the greater risk of coronary artery disease, heart attack, heart failure, and stroke. Obstructive sleep apnea also increases the risk of abnormal heart rhythms or arrhythmias. These can cause decreases in blood pressure, and multiple episodes of these can sometimes lead to sudden death. Obstructive sleep apnea has also been connected to certain eye problems like glaucoma and also issues with the nerve in the eye. And then sleep deprived partners are another issue. Loud snoring can keep those around you from getting good rest and eventually disrupt your relationship. Some partners end up sleeping in another room, and many of the bed partners of people who snore are sleep deprived as well. People with obstructive sleep apnea may also complain of memory problems, morning headaches, mood swings, or feelings of depression, and a need to frequently urinate throughout the night. So, in addition to diet and exercise, CPAP is the gold standard treatment of sleep apnea. In this treatment, a machine delivers air pressure through a piece that fits into your nose or is placed over your nose and mouth while you sleep. The pressure of the air breathed is continuous, constant, and somewhat greater than that of the surrounding air, which is just enough to keep your upper airway passages open. The air pressure prevents obstructive sleep apnea and snoring. CPAP is the most consistently successful and most commonly used method of treating obstructive sleep apnea, but some people find the mask cumbersome and uncomfortable or find the device to be too loud. So there are other alternatives. The other common non-invasive alternative is an oral appliance. This can be a good option for people with mild or moderate obstructive sleep apnea. These devices are designed to keep your airway open by bringing your jaw forward, which then brings your tongue forward. This can sometimes relieve the snoring and the obstructive sleep apnea as well. Other devices may hold your tongue in a different position, and some of these can be very effective for certain people, and other people notice that they cause jaw pain and misalignment of the teeth. Surgical removal of tissue from the back of the throat is another option for the treatment of sleep apnea. One of these common surgeries is called a uvulopalatopharyngoplasty or UP3. And in this procedure, the soft palate and uvula are trimmed and the tonsils are removed. This can be very effective with people that have large tonsils or a very elongated soft palate. And the decision of whether this is the right surgery or the right treatment is really based on each patient's individual anatomy.
Thanks, Dr. Ruther. And I'm happy to just introduce Inspire to the group here. And like I said, I work very closely with Dr. Ruther and will help you once you decide to move forward with the Inspire implant. So overall, it's a safe outpatient procedure. If you are familiar with pacemakers, that is where our technology comes from. So you can see in the picture here, there is a picture of the device itself. That's the actual size of the implant. It looks just like a pacemaker. And as far as your interaction with the device as a patient, you will control it with a small handheld remote. So before you go to sleep at night, you will turn the device on and you will have the ability to make adjustments up and down. So just as with CPAP, you are likely familiar with titrating the pressure of CPAP. With Inspire, we're going to titrate the amplitude or the intensity of the stimulation. And Karen will talk with you a little bit more later in the webinar about her experience and how you use the remote and make those adjustments on your own. As far as the procedure itself, it again is an outpatient procedure. So we typically bring you in early morning for the procedure and you will return home later that same day. It's currently inserted by 3 incisions. The first incision is going to go right over the hypoglossal nerve, which is in the neck. So that is pointing to the airway there in the picture here. The second incision is going to be where that battery or pacemaker is implanted, and that's just under the chest wall. And then the third incision is where there's a breathing sensor that's placed. That breathing sensor is really the whole brains of the system. It's monitoring when you're breathing so that the device triggers stimulation. So we're not waiting for you to have an apnea event. We're actually trying to prevent it throughout the night by monitoring your breathing and then opening up the airway. We have recently updated our technique as well. So, depending on when you have surgery or which surgeon you end up going forward with, you may end up with just 2 incisions. It is a new technique that we're able to offer now, and with the 2 incision technique, we would eliminate that breathing sensor incision. So that third incision would be eliminated. And the breathing sensor would just go in the same pocket where the battery is. So you would end up with an incision in the neck and then an incision in the chest wall. Both of those are options. So depending on your specific case and how the surgeon evaluates you, they will decide what works best for you as a patient to go with either 2 or 3 incisions. As far as recovery, again, it's an outpatient procedure, and typically most of our patients go home just with over the counter medication. So, mostly just on Tylenol, just for some post op pain that day, and returning to non strenuous activities within just a few days. Any long-term maintenance with this device, it's actually pretty straightforward. The battery does last about 11 years because you are only going to use it at night. So once it's implanted, you don't really have to worry about additional surgeries for swapping out the battery for close to 11 years. With any metal device implants, there's always questions about MRIs and the safety behind that. With the Inspire device, you can perform specific MRIs. You are able to get an MRI of the head, neck, and your extremities. There are some restrictions, however, with full body scans. So, if you need a full body chest scan or a spine scan, we would recommend a CT scan in that scenario versus an MRI. All the MRI labeling and information for MRIs will be given to you prior to the implant so that you can prepare if you will need scans in the future. After the implant, we will then bring you in to see Dr. Ruther for a post op follow up. And then beyond that, you will be programmed in the physician's office to turn the device on. So, the device activation, as we refer to it, is basically the first time we turn the Inspire device on. This is going to happen about a month after your implant, and we wait a month just to allow time for your body to heal from those incisions. So, in the interim, if you are able to continue to use your CPAP, we would recommend you do that just so that you are getting some means of therapy. If not, you will have about a month lag time from the implant itself to the activation visit. So during the activation visit, there's a couple things that we're going to look for. We want to establish your initial settings and make sure that they're comfortable but effective for you. So what we're actually looking for is stimulation of the hypoglossal nerve, which moves your tongue forward. So we're looking for a slight movement of the tongue just to the edge of the teeth so that your airway opens up. Once we establish that, we'll program the device and we will educate you on how to use your remote. At this time, I'm going to have Karen actually demonstrate for us the remote control and just talk overall about her experience with the initial device activation. So, Karen?
Thank you. Yeah, when you get into the office, they're going to activate the device and they have you lay back on the table. They will put this programmer connect it to you by putting something on your skin right where your generator is. And then they will activate the device, which will move your tongue out of your airway for a few seconds just to show that it's on. And then they'll like customize the device for you. They'll give you a remote, a, a book, an electronic book to help you titrate at home, and they'll go over instructions on its use. And then they just send you home to use it for your first night, which you would do right after you go home. This is the remote here. The play and pause. This is the off button here, and on the back there's levels, and there's 10 of them here, and they correspond in the front with the plus and the minus button. So when you go home, you'll be at level 1, and everyone's levels customized for them. And then you would make contact and push the play button. That'll move your tongue out of your airway for 4 seconds to let you know it's on, and then it'll start running with a default of 30 minutes to let you go to bed. You can have that setting customized. All the settings are pretty much customizable for each person. And so you would go home at level 1, and then in about a few days or a week, however much the doctor says to do, you'll go up on the press the plus button while it's connected, and you'll go up 1 level. And then when you would return to we return for a sleep study after you've worked your way up the levels on the device with the focus of moving your tongue out of your airway every time you inhale versus it's to give you a therapeutic level, not to see how fast you can work your way up the remote.
Thanks, Karen. And as Karen said, so every patient's levels and remote will be customized for you. So you will start at level 1, but your level 1 may look different than Karen's level 1, but everybody will have the ability to have those settings customized. And you're basically, like Karen said, just gradually working up to a therapeutic level, which for some patients takes more time than others. But overall, it's a couple months for patients to acclimate. And at that point in time, we would bring you back for a sleep study just to confirm that you are using the appropriate settings and getting the best possible outcome. I just want to spend a couple minutes to review some of the clinical data with Inspire. We did launch this device back in 2014, so we are a few years out now with collecting data on our patients. This is specifically 5-year data on our initial patients' clinical trial. One of the things that we look at is the AHI range. So as Dr. Ruther pointed out in the beginning, the amount of times basically that you lose oxygen and are stopping breathing throughout the night. So the average for our patients was just under 30 at the start of our clinical trial, and then that declined down to just about 6 after 5 years. So it's a 79% reduction. So keep in mind, again, with the data in real life, we really try to customize this device to make sure we're getting you the best outcome possible. Most of our patient population are going to be folks that have really struggled with CPAP and are likely more significant cases with sleep apnea. So our goal is to get that number down as low as possible. So even in real time now, we're seeing less than 6 in clinical practice. Dr. Ruther also mentioned bed partner snoring as one of the things that's reported as a result of sleep apnea. So prior to our clinical trial, we interviewed bed partners to report how much snoring they are hearing. So that was 83% at the start of the clinical trial, and then down to 10% after 5 years with Inspire. So one thing to keep in mind, snoring is definitely a good indicator if the device is working. However, some patients still may have some lingering snoring. They may have other sinus issues or things like that that need to be addressed. But overall, you can expect a significant reduction in snoring if that is something that you're struggling with. As far as the patient experience, and you've had some time to hear from Karen, we just basically overall asked the patients what their satisfaction was with the device. 94% of patients are satisfied. They say that it's easy to use, it's comfortable for them. As you saw with Karen's demo, the remote is pretty straightforward. So with that, we have seen increased adherence. So most of our patients are able to get through the night using it with basically up to about 6 hours of usage throughout the night. And again, that continues to improve as we learn more and more about the device and how you're responding to it. We obviously want you to be able to use it all night, every night, and be comfortable with it. Just to review quickly insurance access, because this is a question that typically comes up, and Dr. Ruther will review this with you in the clinic at your consult. Most insurance coverage is pretty good now for Inspire. We have national Medicare coverage, and then there are some policies here listed specifically that have positive Inspire plans. If you don't see your insurance listed, that doesn't mean you wouldn't have access to Inspire. We would just work with you directly and your insurance company to get it prior authorized. So overall, insurance has not been that big of a challenge over the last couple of years as we've gained more access and more positive coverage. I just want Dr. Ruther to recap just the criteria for Inspire and just the process to evaluate patients. So Dr. Ruther, if you want to just go through this summary slide.
Yeah, so in order to qualify for the Inspire implant, one has to have moderate to severe obstructive sleep apnea. So when we look at a sleep study, we look at the AHI, which is the average number of times you stop breathing per hour. And we want that number to be between 15 and 65. Obviously, you have to have tried a CPAP as well, because that is the gold standard. And so the person must not be able to get a consistent benefit from CPAP. You may not be significantly overweight. So I think the cutoff is 32 with some insurances for BMI and 35 with others. And then you have to pass an airway exam. And what that means is what we have to do is do a drug-induced sleep endoscopy as the first step to see if if the airway collapse that we're seeing is amenable to being repaired with the Inspire implant. And so what that means is we're looking to see if the airway collapses in a front to back configuration or a circumferential configuration. 80% of people have a front to back closure, while 20% or even less have solely a circumferential closure. And if you think about it, this implant is really going to help those that have that front to back closure, so that when we move the tongue forward, that opens up the airway. So what we do is we take you to the operating room, put you under anesthesia just until you're sleeping, and then we take a look at the airway with a little camera pass through your nose, just to see if your anatomy is right for this procedure. And then we want to make sure that it is predominantly obstructive sleep apnea, and that there are less than 25% of central apneas on your test. And that's something that we can just review in clinic together and what that means. And then this is approved for ages 18 and over.
Perfect. Thanks, Dr. Ruther. The last couple minutes here, I just want to have Karen, again, just take the stage and share your story a little bit. If you can just share with us, Karen, how you started your journey and where things are now that you have had the Inspire for a couple years now.
Yeah, sure. So I started my sleep apnea journey quite a long time ago. I didn't know what was wrong with me. I went to the psychiatrist office in late 2011 with anxiety, panic attacks, and memory loss. And I was having word finding difficulties. And that kind of just kept accelerating. And I went to a number of specialists without really finding out what was wrong with me. And then I had a sleep study in late 2015. And I found out that I had obstructive sleep apnea. And then I tried a year of CPAP and a year of BiPAP. I had nasal turbinate reduction. I did cognitive behavior therapy for insomnia and for nightmares from the mask. And I took a pill to stay awake for a year. And I was not able to get relief from the CPAP or BiPAP. I did happen to swallow a lot of air at aerophagia, which, for me meant that though the machine, I got a happy face every morning to tell me I did well, I didn't feel better in the morning. And then the memory impairment that I had turned into a diagnosis of a mild cognitive impairment. And that doesn't have a very good outlook I was told by my doctors that if I didn't get a successful treatment for my sleep apnea, that I wasn't gonna get any better. In fact, I might end up with some form of dementia in my future. So I was very motivated to find something that would work. And the nasal turbinate reduction was done by a doctor that also does Inspire. And so I went in and did a consult and found out I was a candidate after doing the sleep endoscopy. And since I've been had Inspire, my life went from having a 20.6 AHI, which is moderate sleep apnea, but I'd stop breathing up to 74 seconds at a time. So my oxygen saturation was really low compared to how it is now. It was 82% at its lowest. And that was what I was told was causing my memory impairment. And now it's a 4, so I'm technically cured. And those apneas are much shorter and I have less of them. And my oxygen saturation doesn't go below 90%. So I'm feeling a lot better. I'm able to stay awake without a pill, which I was able to do since the first night of sleep with Inspire. My memory impairment has significantly gone away, and I feel like a whole new me. I'm able to function throughout the day and really get restorative sleep at night. And it's just been a real game changer for me.
Thank you so much, Karen. I always enjoy hearing your story, and I think it's very helpful for anybody that is considering Inspire to always hear from somebody who has gone through the procedure themselves and to see how they're doing at this point in time. You can actually take a listen to Karen's story and some of our other patients on our Inspire app. So there's just some information here on how Inspire works and some other Inspire patient stories. So if you'd like to download the app, it's a free app on the App Store. And eventually what will happen with our Inspire devices, we will transition to fully digital health, where we can actually monitor your usage of the device and how you're doing through the app. So it is an evolving technology, but for now, the app is a really good source of information as well. So thanks again, Karen, for sharing your story. I just want to give Dr. Ruther a chance for some closing remarks and just how to contact the office and get set up with you for consultation.
Thank you for joining us. And so, as Gina mentioned, here is the information to reach us. Feel free to email us or visit our website and put in an inquiry. We're still doing telemedicine visits if that's your preference, or in person visits as well. So, give us a call and we'd love to meet you and talk more about the Inspire procedure and other options for treatment of sleep apnea.
Great. Thank you so much, Dr. Ruther. And thanks again, everybody, for joining us today. Take care.